One of the questions that we have to answer when we are using the TMACS decision aid is whether the patient has worsening angina. So, what do we mean by that? And how do we decide whether we should answer yes to that question? Well, worsening angina doesn't necessarily mean that the patient has a known past history of angina. This relates to their current symptoms, the pattern of their current symptoms. So you've got to take a full history. You've got to find out what's been happening to this patient over the last, since their chest pain started. And we would classify the patient as having worsening angina if they've got chest pain or discomfort in or around the chest that seems compatible with an acute coronary syndrome, but the symptoms are getting worse over time. So it may be that the pain is occurring with greater frequency over time. It may be that the pain is occurring with greater intensity over time. Or it may be that the episodes of pain are lasting for longer each time. Alternatively, it might be that the patient is known to have a diagnosis of angina, but they've had a single episode of pain that is far more protracted or severe or intense than they would usually get with their angina. So it's still a worsening pattern of that angina. Under those circumstances, we'd say that the patient has worsening angina. Some people call it crescendo angina. The symptoms are sort of coming to a crescendo. And it's those patients we'd score as having worsening angina, which makes the diagnosis of acute myocardial infarction and the occurrence of adverse events in the next 30 days more likely.